This is part 3 in a series of presentations about standards in vital records, all 5 minutes or less. This presentation is about Vital Records Death Reporting, or VRDR. It is an IHE standard that uses the HL7 CDA document approach to get death certificate information from an EHR. Problems with getting death certificate data from an EHR. First, EHR data doesn't directly conform to vital statistics definitions and requirements. And second, we still want doctors to enter the cause of death sequence in text, just like they do now. The first step in the process is the form request, where the physician is logged into the electronic health record of the patient. From within the patient's record, the physician can click on a button or a link to request a death certificate. This leads to the next step, extraction and translation. The electronic health record extracts relevant information from the patient's electronic health record, translates it into the HL7 standard CDA format, then transmits that CDA to Vital Records Form Manager. On the Vital Records Form Manager side now, we have population, where the HL7 standard CDA is used to pre-populate a web form. The pre-populated web form is sent back to the electronic health record to be completed by the physician. Note that there's not much to pre-populate on the death certificate, at least when compared to birth certificates. Most of the pre-pop information on the death certificate includes information about the physician and the facility certifying the cause of death. Also note that demographic information about the patient on the CDA is used to link the certification information with information provided by a funeral director. The fourth step in the process is completion and submission. Now has a cause of death pre-populated web form that looks like the web form in your current EDRS system. The physician can complete the cause of death and other relevant pieces of information provided by the physician, then clicks to submit the web form back to Vital Records Form Manager. The last step is registration. The completed web form is submitted back to the Form Manager, where it's combined with information from a funeral director to register a death certificate. 5 steps at an overview level. The first is the form request. The physician clicks a button within the patient's electronic health record. A CDA is extracted and translated from information in the EHR and is submitted to the Vital Records Form Manager. The Form Manager uses information in the CDA to pre-populate a web form, send it back to the electronic health record. The physician in the EHR completes the web form and submits the certification information back to Vital Records for death certificate registration. A couple of questions about the VRDR process. First, the content of the CDA document produced by the EHR is specified by HL7. The answer to that is true. The CDA document is defined by HL7 so that it's standard for every EHR. What types of information are pre-populated on the death certificate? Information about the physician and the facility are pre-populated on the death certificate. The CDA contains demographic information about the patient, such as name and date of birth. How is that information used? The information is used to link to the funeral director portion of the death certificate only. It does not become part of the permanent death certificate record. That concludes this presentation. My contact information is shown if you have questions.